Hi, I'm Kerwin from Catapult, and I have Tyson Fuehrer from Biggs Insurance Services with me today. And I wanted to chat with Tyson about data. We all hear that it's super important. There's so many sources to get it from. Employers are getting it from TPA, from health plan, from brokers and consultants.
Yeah.
What do they need to be looking for?
Well, there's a lot of different places, like you mentioned, that they're coming from. The biggest challenge, I think, is that the data in the past has really just been so looking back. And the challenge, I think, for the employers is that they're having to pay their benefits looking forward. So finding some type of data source that you can forecast in that area is super important, and there's not a lot of those out there. We're faced with that all the time. You hear a lot of things around care gap analysis and things like that. But the challenge is again, typically it's looking backwards. But most employers that we talk to today are trying to find ways to work on programs next year, so that they can actually affect the cost of what they're going to be paying in years 2, 3, 4, 5.
Okay, so when you get the data and you're looking forward, what are you looking for? What do you do with it? How do you make sure that you're actionable on it?
Yeah, I think that the biggest thing is that you have to have an employer that's interested in engaging the data, because there is so many different versions of it. And so that's step number one, is making sure you have the right people that are on the bus that want to take it on that way. After that, it's really then designing and looking at the things that you can impact the most. And so a lot of times you're looking at different types of ways to do preventive services, or you might be talking about RX management, those kind of things. I think that the challenge that we find the most is that you get the data, and a lot of times you get like a category, say like diabetes. And with diabetes, it's like, okay, so now what? Because you have a diabetic population doesn't mean that you can't do anything about it, but you need enough information about what they're maybe not doing to be able to be taken care of. And so that's the real kind of the data points that you need to find, so that you can